Hello, I'm Dr. David Cathcart. I'm a family practice physician from Heartland Regional Medical Center in St. Joseph, and we're going to talk about chemotherapy drugs and their side effects today. Chemotherapy, unfortunately, with all the good that it does in killing cancer cells, can unfortunately cause some lasting side effects. One of those side effects is infertility. In some cases, infertility can be permanent as a result of what's called the germ cells, or those cells that are responsible for producing sperm or eggs. Those cells are very sensitive to chemotherapeutic agents and can be damaged, and frequently is the case after shortly after chemotherapy, someone will be or can be infertile for some period of time. The good news is that in most cases that infertility goes away. Lung damage. You can have scarring that occurs in the lung, and while many times most of the times it's fairly mild, it can be permanent. There can also be damage to the heart that may or may not be permanent, but when it damages the heart, usually it's damaging the muscle, and the heart muscle can't contract as hard as it otherwise might. Hearing is a common problem. That's a lasting side effect of chemotherapy or certain chemotherapeutic agents, for example, cisplatin. Aside from, or one of the consequences of permanent hearing loss and nerve damage in the ear is a condition called tinnitus, which is essentially a constant ringing or a buzzing or a sensation that you're hearing crickets in your ear. And that condition, unfortunately, is not currently fixable. The good news is that all these side effects, while they can happen, they don't happen to everybody. Each of these side effects are peculiar to a specific drug. Some drugs are more likely to cause these side effects than others, and most all of them can be treated. This is Dr. Cathcart talking to you about how the chemotherapy drugs can have some lasting or permanent side effects.